you know, when your thyroid is not working properly, you can have a number of things going wrong with you in a number of ways that you're not feeling right. One of the biggest complaints is fatigue. I mean, if you're suffering fatigue is a big complaint with hypothyroidism. Increased weight gain, even on a low-calorie diet. You know, I have patients that they're eating 1,200 calories a week. They're doing a boot camp. They do this for 6 months, and they haven't lost a pound. You know, if that's the case, there's obviously something wrong. It's not your genetics. Morning headaches that wear off as the day progresses, depression, constipation, sensitive to cold. You know, it's middle of summer and your hands are freezing and you're cold. Poor circulation, numbness in your hands and feet, muscle cramps, catching cold, getting sick all the time, wounds heal slowly, require excessive amount of sleep to function properly, digestive problems, itchy skin, dry, brittle hair, hair loss. You know, people start losing their hair, leg swelling, edema, and also the loss of the outer portion of the eyebrows. Those are some, if you have a lot of those symptoms, chances are you have some thyroid dysfunction. Now, your thyroid, you know, if you remember the story in the beginning of my webinar about the testimonial that I showed, and so many things got better. The reason is because your thyroid, every cell in your body has thyroid receptors. So if your thyroid's malfunctioning, there's many different parts of your body that are going to go askew. And one of them that your thyroid supports is bone metabolism. Thyroid secretes something called calcitonin, which is responsible for you know, laying down bone. And many patients that have thyroid problems for a long time, I'll end up watching they're on an osteoporotic medication because there's issues with that. Anemia is another one. You know, your thyroid is responsible for promoting good stomach acid in the stomach. And when you have low thyroid, stomach acid's going to be down. And what's going to happen is you're not going to have B12 and iron absorption, and that can lead to anemia. Anemia, you know, when you don't have oxygen going to the red blood cells into the tissues, you're not going to feel good as a result of that. Body heat, night sweats, and sweating. You know, the thyroid's like the thermostat of your body. It controls body temperature. It becomes an issue of thyroid, estrogen imbalance, or adrenal glands. Now, if you're sweating a lot, that's an adrenal problem. And uncovering this, you know, this is a big symptom that people come in with, especially the ones that may be going through perimenopause, menopause. You have to support the adrenal glands in that situation to get things balanced. Another problem is estrogen metabolism. When your thyroid is low, the liver detox pathway, especially detox pathway number 2, which is responsible for getting estrogen out of your body. Estrogen's not being able to get out of your body. It's going to build up in your bloodstream and get stored in your fat tissues. High levels of estrogen are very bad. I'm sure you've read about that before. It can cause cancer. It can cause ovarian cysts and a number of other things. So very bad situation there. Gastrointestinal dysfunction. Again, I mentioned the stomach acid not being proper. Also, we can look at the intestinal tract, you know, not the motility being slow that can cause constipation. Liver and gallbladder. If you've been, you know, one of the biggest things I see, John, is with thyroid patients, when I consult with them and they've had this problem for a long time, there'll be a little box that says, have you had your gallbladder removed? And many of them will select yes. Most of those patients, so here's what happens. Your liver and gallbladder become congested because you have low thyroid symptoms. With this backup, you can't detox things. The gallbladder becomes inflamed. You go to the doctors, by golly, we got to get your gallbladder up, and it's gone. So, you know, that's a very important area to fix, and it all comes back to finding the cause of the problem. Progesterone production. Progesterone is secreted during the second half of your cycle. So if you're a woman out there and you feel miserable during just before you have your period, the 2 weeks leading up to that, very well you don't have progesterone production there. And what you need is a nice progesterone surge that's going to stimulate TPO production, which is going to help your body produce thyroid hormones. So when you have an imbalance there, you know, you're going to have all those symptoms come along with that: heavy bleeding, difficulty losing weight, irritability, headaches also. Fat burning, you know, this is an easy one to figure out. Your thyroid runs your metabolism. If your metabolism's slow, you're not going to be able to burn body fat at all. Insulin and glucose metabolism. glucose isn't going to be absorbed by the cells as well as it's supposed to. And what'll happen there is you're going to start to gain weight. You're going to have fatigue after meals, but you can also have the hypoglycemic pattern there too, with the headaches and brain fog. Brain fog, your brain needs glucose. It needs glucose all the time. And when you're not absorbing glucose properly, brain fog, fatigue, difficulty concentrating are the symptoms that come there. Healthy cholesterol levels. Everybody's concerned about cholesterol these days, but I'll tell you, cholesterol is managed by your liver. Your liver manages the amount of cholesterol in the bloodstream. And if you have low thyroid, again, I mentioned liver's going to be congested, and you may have an excess amount of fatty acids in the blood. So you'll have high LDL, high triglycerides, and high total cholesterol as a result of hypothyroidism. So fixing that, you go to the doc. Let's see, he's going to put you on a statin drug. But the reality is, if you fix the cause of that, all of that will come into place, which I see many times. Triglycerides level come into a normal range, which you want around 100 or below. Constipation. Some people think this is just a simple thing. I can't go to the bathroom. But let's understand, when you have undigested food that needs to get out of your body, it's waste. It's waste particles. And if these waste particles are sitting inside your body for a long time, it's going to promote bad bacteria. Bad bacteria, when you get this overgrowth, it's going to cause something called dysbiosis, which really is a bad thing for your digestive tract, and that can cause enormous other different symptoms and situations. So you can see from what I just mentioned, if you fix the right thing, how many different things can start to feel better, and you can now understand why the patient in the beginning felt such a dramatic change in so many different areas of her body. The reason is every cell in your body has thyroid receptors. So here's some things to look at. Everybody wants to know, well, why does my doctor not check this, or what do we need to look for? And I'm going to list a few of the things here for you. One of the things that you need to look at is food. People have food sensitivities, and I'm sure everybody's heard gluten. People have gluten sensitivities, and I'll have patients to come to see me and say, I've been on a gluten-free diet. I've tried that. It didn't help me. But, there's a lot more to it than just being on a gluten-free diet. But looking for food sensitivities like dairy, egg, milk, soy, rice, potato, these other foods that gluten-free foods are made of, we run a panel that we check that. We check to see if a person will have a problem on a gluten-free diet. So evaluating and testing for food sensitivities is big. Checking the digestive organs. I mentioned that in the earlier slide. The liver, the stomach, the small intestine, the large intestine, the pancreas, the liver. Very important to check. Another one that's big is autoimmune disease. There's an autoimmune disease that affects your thyroid called Hashimoto's. You need to be checked for that, because if you have that and you don't address that and you don't fix that, you're never going to get better. There's certain specific things we need to do to fix that, but if you want to find out what's wrong with you, that's one of the things we got to look at. Next, hidden infections: virus, mold, Lyme, parasites, bacteria, yeast overgrowth. These are some things that could be driving an autoimmune disease. Anemia. You got to check for anemia, because if you have anemia, that could be very well causing your symptoms. Lack of oxygen to the red blood cells and delivered to the system you're not going to feel good if that's happening. Adrenal glands and blood sugar imbalances. A lot of these problems, mimic thyroid issues. Like if you have high blood sugar, you're going to have fatigue, you're going to have weight gain, you're going to have hair loss. And you have to decipher which one of these problems is the one to look at. But adrenal glands and blood sugar and cortisol, that's a physiological pattern that goes together that we need to look at. Next is environmental, chemical, and metal toxicities. If you have a buildup of these toxins in your system, that can also lead to autoimmune disease. Leaky gut is another one. I think Dr. Oz did a presentation on his show with intestinal permeability. I got a lot of calls to my office and even patients of mine saying, wow, look at that. I mean, Dr. Oz is talking about leaky gut. It's a big thing. It's a big thing. Leaky gut is like it sounds. If you're digesting food and you're eating things, it needs to stay in the gut and it needs to get out of your system. If it's leaking into your bloodstream, it's not a good thing. It's something that I think every one of my patients, once a year, we do a program for 2 weeks to fix the leaky gut. Vitamin D deficiency, I know a lot of patients have had their vitamin D levels tested. A lot of patients come in and say, I take vitamin D. We do the test and we find out that they have low levels. If you're going to take vitamin D, take a good quality vitamin D, but make sure your levels are between 50 and 80. You know, the normal lab range, if you're in the 32 range, and if you have an autoimmune disease, you need to get those levels between 50 and 80, 60 and 80, right around there. So again, it's not the big thing, but if you have a deficiency in vitamin D, it can lead to autoimmune disease. So these are some common things that we got to look at to, again, get to the root cause of your problem. And I'll tell you, I've never had any patient come and consult with me that has had all of this checked. Okay, so next slide. And this looks scary, okay? And I'm not going to put you to sleep with this slide. Trust me, okay? I just want you to, you know you have a thyroid problem, or you're suspecting you have a thyroid problem. Your doctors run a TSH test. I just want to give you a visual of what's happening. You know, what is thyroid hormone and what does it do to me? And I want you to kind of get a picture of how it actually gets into the cell and does its job. And you can kind of see, you know, people have probably heard about TSH, T4, T3, this kind of stuff. But I'm going to walk you through this real slow, real easy, and just so you can get an understanding of what's happening. So we start up here with the hypothalamus and the pituitary gland. So pituitary gland, you know, that's the gland that secretes hormones. And when you have anything that's affecting pituitary function, or you have a sluggish pituitary, hormones are going to have a hard time being secreted. But anyways, the pituitary secretes TSH. Okay, that's the popular number, popular test that everybody has if they have a thyroid problem. But the reality is the thyroid doesn't secrete TSH. It's the pituitary gland secreting TSH to tell the thyroid, give me some hormone. Let's produce some hormone. Your thyroid gland produces T4 and T3. Okay, those are your thyroid hormones. T4 has 4 molecules of iodine. T3 has 3. Your body produces 93%. Probably right, 97 to 3%. But there's a big ratio. It depends on what source. But 97% T4, 3% T3. T4 is inactive. So understand, T4 being inactive, it can't do anything. It's not going to do anything in your body. And through your body, T4 is converted to the active form of thyroid, T3. It's converted in the liver, it's converted in the gut, and it's converted in the muscles and other cells. So T4 actually becomes T3, and T4 and T3 are delivered to the cells by a protein called thyroid binding globulin. They get delivered, they get transported to these cells. Eventually, it gets to the cell receptor site where the cell has to signal the receptor. The cell accepts T3. Okay, free T3 is what gets into the cell. Once it gets into the cell, signals the DNA, and it runs your metabolism, does the thing that it needs to do. So, with that said, you know, if we're evaluating for and we're trying to figure out where your problem is, it could be at any number of these steps. And you know, when you're doing blood work, you have to look at these things. With that said, there's 7 different patterns. So there's 7 different ways through this pathway that you can have a thyroid problem. Okay, the first one is primary hypothyroidism. Okay, if you have that, it's specifically a problem with your thyroid. 10% of the population have this. That means your thyroid is not pumping, it's not producing thyroid hormone. You get put on thyroid medication, 10% of these people feel great. They feel great, and if that's you, you're probably not listening to the seminar, and you don't have any problems. Now, that's only 10%. So if you're on thyroid hormone and you're not feeling right, you don't have primary hypothyroidism. You have another pattern, which is what we got to look at. So the other one is pituitary. You know, I mentioned pituitary. You could have hypothyroidism due to your pituitary being sluggish. You can have hypothyroidism because we're not getting enough T4 converted to T3. I mentioned that in the earlier slide. You can have too much conversion, where you're breaking down too much T4 into T3, and what's going to happen is your cells are going to become resistant to the T3. TBG elevation. I mentioned the protein that carries thyroid hormone, thyroid binding globulin. If you're on hormone replacing therapy, it's going to cause an elevation in TBG, which what's going to happen there is thyroid hormone is going to get locked into this protein, and the protein's not going to let it out into the cell to be delivered, and you're going to feel the way you do as a result of that. Thyroid resistance is another one. You know, your cells become resistant. There's insulin resistance. There's hormone, which is a hormone, and also your cells can become resistant to thyroid, meaning they're just not. The cells are not communicating. There's no communication. And lastly, but probably most importantly, is autoimmune disease. You have to know, do you have Hashimoto's or not? And that's one of the big things that's missed. There's so many patients that I see, and we run the tests. We run the Hashimoto's test, TBD, TPO, and TBG antibodies, and we find out they have hypothyroidism. I mean, they have an autoimmune disease that's attacking your thyroid. We'll get to a slide where I'll talk about that a little more, but these are some big patterns right here that if we uncover, we're going to get to the root of your problem. So, Hashimoto's thyroiditis. I mentioned to you 27 million people in the United States have hypothyroidism. 50% of those have Hashimoto's. The reality is nobody knows they have it because the doctors aren't going to run the test because it's not going to change their plan. I mean, they're going to give you a thyroid hormone whether or not you have Hashimoto's or not. So why test for it? And the insurance company is going to say, why do we need to pay for this? It's not medically necessary. But the reality is if you have Hashimoto's, it means you have an autoimmune disease. That means the problem with your thyroid is not the thyroid. Your thyroid's being attacked by your immune system. Okay, so if you're going to fix the thyroid, you have to fix the attack to fix the thyroid. I mean, it's a simple point, and once you get that concept, that's where your problem is. So then, to fix the person, you have to figure out, let's manage the immune system. Manage the immune system, and that's what happened with the person. Again, the testimonial that I shared in the beginning. She had Hashimoto's. It was never managed. We managed the immune system, fixed the problem, and you can see all the things that got better. So Hashimoto's is very big. You have to get checked. Listen, in the United States, if the reality is 70 to 90% of 70 to 90% of hypothyroidism cases in the United States are related to autoimmune disease. If you've not been checked for that, it's a huge mistake. You have to check. Okay. Now here's some tests that we do, specifically thyroid tests, and there's a lot more to look at than just TSH. When we run a panel, we run an extensive panel to rule out what's happening. Again, we want to figure out what pattern of thyroid dysfunction you have. And there's a lot more things to run. You got to look at T3, total T3. T3 uptake, and T3 uptake is going to give us an idea if you have some hormone imbalance. It's just a kind of a indirect way, but if you got estrogen imbalance, T3 uptake is going to be low. If you have excess testosterone, then T3 uptake is going to be high. So just some other things to look at, mainly to discover what's happening with your thyroid. But again, running those antibodies is key. Here's some tests that we do in our office. Do we do all of these tests on everybody? No, it depends on what's happening with the patient. Obviously we're going to, we'll go back to that one. Obviously we're going to run a complete thyroid panel. We're going to investigate your organs, liver, kidney, gut. We're going to rule out anemia. We're going to do a CBC with autodifferential to check for infections. Remember, infections could be a problem. We check your adrenal glands with cortisol. It's a salivary test. I mentioned that adrenal glands are important, but cortisol can affect the pituitary gland, and again, pituitary gland secretes hormones. We got to make sure pituitary gland isn't sluggish, and the adrenal glands can affect that. Food sensitivity testing. We don't just tell a person to stop eating some foods. Sometimes if you have a restrictive diet, it's going to be impossible to follow that for the rest of your life. So, we can do some testing to figure out what foods people can and can't eat. We use Cyrix Labs. Not only do we test for gluten if need be, dairy, soy, egg, rice, potato, and a number of other foods. So we really can figure out, this is what you can eat and this is what you can't eat. It takes the stress off of me, actually. It's not I'm not telling you can't eat this. This is what the tests show. And listen, that usually gives some people some motivation that, I can't eat dairy or I can't. So it's not me telling you what you can and can't eat. A test comes in very handy with that. We also do some stool testing if we need to. Again, if we're going to test for gut infections, parasites, yeast, mold, and bacterial overgrowth, stool test comes in handy there. So again, do we just throw all these tests at everybody right away? No, I mean we do our evaluation in the beginning. We try to figure out where the issues are, and then we decide what testing we need to do to come to the conclusion. So, John, I've come to the end of my discussion here with the slides. I think we were going to show a video, I believe.
Yes, let's go ahead and play the video that you've got on your website that shows that amazing transformation that one of your patients went through. So
yeah.
Let's go ahead and play that now.
To what people what I had to say, and you followed a very extensive program of looking into what the problem was,
right?
And you identified it, and now we're working through solving it.
And you're a retired nurse, so you got some background in this. So some people are skeptical or thinking, this is not the right way, but it kind of made sense to you then.
It does make sense to me. It's logical. You explain everything very carefully and clearly, and I'm really happy I'm here.
Okay. Last question: was it worth the money?
Yes.
Okay. All right. Thanks, Ellen. Okay. Hey, Ellen. So it's been about a year since we've been working with you, and so tell us, how are you feeling now?
There is no comparison between how I felt a year ago when I first came here and now. It's just amazing to me. I am so much better.
And you lost some weight too? How much weight have you lost total now?
Almost 40 pounds.
Wow. Energy's good?
Fantastic.
Okay. All right. Thanks a lot, Ellen.
Before we get into the questions, why don't you take a minute and talk about the type of testing that you put together in your Getting Started package. Again, it doesn't cover all of the possible testing. It's just where you recommend somebody start out at their testing. Yeah. So go ahead and describe that testing.
Here's everybody says, "Can you help me?" At the end of my seminars, people raise their hands, and everybody wants to know what's wrong with me, and specifically, can you help me? It's impossible for me to answer that question, without any investigation. And if the patient that you just heard on the video, her problem was her blood sugar. The doctor had her on cholesterol medication, he had her on thyroid medication, tested her vitamin D, and the reality is we fixed her blood sugar issue and everything got better. So it's a matter of finding out what the problem is. So how we're going to do that is, number one, let me review the blood work that you have. Get me a copy of the most recent blood work that you have, and we're gonna look at that. We're gonna do a case review and see what you have going on and see if there's any missing things we need to look at. Number two, you're gonna get my paperwork. You're gonna get a questionnaire from me, and it's gonna be detailed, but it's gonna help me figure out, is it hormones, is it blood sugar, is it thyroid, is it gut, is it liver, is it heavy metal toxin? What this is gonna give me some clues. On top of that, we're going to meet, and I'm going to do a physical evaluation on you. Also, included in my Getting Started package is the test, the blood test, to see if you have Hashimoto's or not. Like I said many times, we need to know if you have an autoimmune disease. If you have your immune system attacking your thyroid, we need to deal with that. And that's, out of all the things that people are missing from the get-go, it's that test. So I'm including that in the package. You're going to get a requisition, a piece of paper mailed from my office, mailed to you. You're going to go to the lab, and we're going to check, and we're going to find out if you have that or not. And that's going to give us a nice starting place. So then when I meet with you and we go through the evaluation, I'm going to be able to determine really where we need to go with this and whether or not I can help you or not. So that's what I put together, just so I can really, we're not wasting any time talking, but we can really get to work, deciphering where to go.
Okay, that sounds great. And I just want to remind our viewers that that's a $350 package that he's making available to us for $65. That's for anybody who's watching this event live or the replay as we keep it up for some period of time. If you're watching that replay, you can get that same offer of just $65 for $350 worth of consultation and testing. So that's quite the package. Let's go ahead. There's been a bunch of questions submitted, but I know we're almost out of time here. So let's just take, I'll take 3 or 4 of them and read them off to you. And let's bring you up on the big picture here again and have you answer a few of these questions. The first one came in from Mary in Northville. She says, my doctor is always adjusting my medications and I never feel any better. They say my blood work is normal. It's very frustrating. Can you help?
Yeah, good question. You know, here's what's happening. Your doctor's trying to get the TSH normal. Okay, and very common, if you have an autoimmune disease where your immune system's attacking the thyroid, your TSH is going to go up and your TSH is going to go down. So when you're having your blood tested, you're trying to catch where this autoimmune attack is going on, and it's impossible. So your doctor's going to be trying to chase this TSH to get it in normal. So if that's happening, there's a very good chance you have Hashimoto's autoimmune disease.
Okay. Next one is from Tony in Sterling Heights. He's saying, are the tests you mentioned covered by insurance? And if not, how much does it cost?
Yeah, good question, Tony. Here's the thing. If your blood work is normal, your insurance company thinks you're normal. So doing any further testing, they're not going to do. It's not medically necessary. I'll tell you, some of the labs that I use are very, they're very detailed. They're very specific. They don't even accept insurance. So I'll tell you right off the bat, the majority of your care with me is not going to be covered by insurance. Now, if you have some musculoskeletal problems and there's something that your insurance covers like that, yeah, you may have some benefit with that. But nutritional supplements, dietary consultation, those are not covered benefits. Some of this specialized testing, it's not covered. Now, with that, how much is it going to cost? I mean, it's a very common question. People want to know how much money they're going to have to spend if they go through with anything to see me. I'll tell you, I have patients that have minimum wage jobs, and I have patients that are millionaires. They're both patients, so they both found a way to make it affordable. If you can budget anywhere between $100 a month to $300 a month, you can afford care at my office. We have programs available for you. So, is it 300? Is it 100? I don't know. It's going to depend on the testing that we do. It's going to depend on your case. I'm just giving you a range so that there's no surprises when you come and see me. The last thing I want to do is waste anybody's time coming to see me, and then at the end of the day, they ask me, oh, I thought my insurance was going to pay for all this. It's not going to happen. Now, spending $100 to $300 a month, many times I ask my patients, was it worth the money? And you'll listen to some of the people that what they say. They say absolutely. Some of them tell me they'd pay 10 times more than what they did. And along with money too, I have some friends and family members, and nursing home costs are about $3,000 to $5,000 a month. And when you put things into perspective, you have the opportunity to regain your health for $100 to $300 a month. You're going to improve the quality of your life. You're going to be able to enjoy your life much better. And you put that into because ultimately, listen, you're going to spend money, whether it's on a copay because your medication isn't covering it or some kind of long-term assistance. Your money's going to go on healthcare one way or another, whether you spend it now or whether you spend it later. So when people talk to me about money, put this into perspective. I mean, $100 to $300 a month to get your life back, it's a no-brainer to me. Compared to a $3,000 to $5,000, that's your life savings. Literally, your life savings disappear. And what are you getting for that? Just nothing, And so, anyways.
Okay. Next question's from Vera in Farmington Hills, and she's asking, how long does it take to help somebody?
It depends on how bad you are. If you had your problem a long time, it's going to take a little longer to get you back. Typically, it could be, for some people, 2 months, 4 months, 6 months. If it's really bad, it could be longer. But anyway, anywhere from 6 months or so, we should see some good resolution.
Okay. Next one, the last one we'll do here is from Beth, and she's out in Mount Pleasant, and she's saying, I live 2 hours away from your office. How much am I going to have to go see you?
Yeah.
She's concerned about having to drive down from Mount Pleasant.
Yeah, I have patients that live an hour or 2 hours away from me. I have a patient that, literally lives in New York and flies to California and back and forth. So ideally, I'd like to see you one time, for sure. Come into my office. We need to do a face-to-face a meeting, decide what's going on, and then from there we can decide on maybe phone consultations or even Skype consultations, this way to help manage your case. So we decide that after that, but that's how we would handle that situation.
Okay, okay. That's great information. Dr. Sladek, I want to thank you for joining us today. This has been some, I know I learned a lot, and I hope that our viewers learned a lot, and I hope that our viewers will take advantage of that Getting Started package that you've put together, because if they're suffering with any of those symptoms, they don't need to suffer. There is a way, and you've found a way, and it's just a matter of getting people in there to go through the right testing and get started with you. If you're not ready to get started today, there is the additional educational material you can sign up for that Dr. Sladek's put together that is available. Just sign up below this video and you'll be able to receive the additional series of emails. And as I said earlier, one of the best things you could do is help spread the word on this through social media. So get this posted out on Facebook and help this spread around the world and help us spread the news. So that's it for today's webinar. I'm John Callahan again for Health Webinars, and our job is to use this wonderful Google Hangout tool to spread the information around the world and let everybody learn about health problems. So thank you again, Dr. Sladek. I believe I'm scheduled to meet with you on the 29th, so I'll see you then.
Yeah, look forward to seeing you, John. Thanks.
Okay.